I'm going to be doing a newborn assessment today on this baby. First of all, I'd want to make sure that I have the right baby, so I'm going to check baby's wristband. And we do have the right one. So before we begin, I'm going to perform hand hygiene, and I'm going to put on some gloves. For the first thing, we want to get the baby's vital signs, and I'm going to get the temperature. And in infants, we take the temperature under the baby's armpit. So I'm going to go ahead and do that. So I'd get it and I'd place it under the baby's armpit. And sometimes this can take a couple minutes to get the actual number in the baby's. And after that, I'd want to make sure we get the pulse and the respirations on the infant. And in infants, the temperature normally ranges from 97 to 99. The pulse ranges from 120 to 160. And the respirations range from 30 to 60. Anything within that range is normal. After that, I'm going to listen to baby's heart sounds and breath sounds. So I'm going to go ahead and do that. And we want to make sure we listen to the breath sounds bilaterally, just to make sure you listen to everything. After that, we are going to assess the baby's head, so we're going to take off his cap. And when you're looking at the baby's head, you want to look for any signs of like molding when the baby was coming out of the birth canal, and I don't really see any. I want to assess for the anterior fontanelle, which would be diamond shaped, and it is larger than the posterior fontanelle, which is in the back, and I just want to assess for those. And I want to assess and make sure that the baby does not have any like cephalohematomas or the succedaneum, however you pronounce that. And this baby does not, so there was no pressure injuries from when the baby came out of the birth canal, so that is good. After that, we want to assess to make sure the baby doesn't have any bruises or scratches on the head that could have occurred during birth or from forceps or just anything like that. And this baby looks fine. So after that, we want to assess the baby's eyes. We just want to make sure they are symmetrical, and we want to look for if there's any drainage or epicanthal folds. And like if the eyes are not symmetrical, that could be a sign of Down syndrome. So you just want to look and make sure that they are symmetrical and this baby's are fine. The ears, you also want to make sure they are in good position. You want to make sure they are not low set or in a position that might indicate Down syndrome again. After that, you want to check the baby's ear recoil. So you're going to fold up the baby's ears and let it go. And a slow recoil means that the baby's cartilage is thicker and that it's likely a post-term baby. So this is just a way to see like the maturity of the baby, and this baby is fine. From there, we want to go on and check the baby's mouth. We want to see if the baby has a rooting or a sucking reflex. So we see if the baby would come towards my finger when I stick it in the baby's mouth, and then I would stick my finger on the roof of the baby's mouth and it would elicit the sucking response. And I also want to feel for any cleft palates or anything in the top of baby's mouth, and this baby is fine. So after that, I am going to check the neck. We want to make sure the neck has appropriate range of motion. So gently move baby's head from side to side. Just make sure everything's okay. You want to feel for any masses in the back or around the sides, just to make sure that nothing's out of the ordinary. If there's like a fat pad in the back, that could indicate Down syndrome. And any other masses could be a problem, so you just want to feel for anything like that. And afterwards you go on to check baby's clavicles, and you want to make sure they're intact because they could have gotten broken during the birthing process, and this babies are fine, so that's good. Now the next thing we need to do is check the baby's skin, and that means you're going to have to undress the baby a little bit, and so you definitely want to keep the baby warm during the assessment as best as you can because they are very sensitive. So keep as much covered as you can at a time. And now when we're looking at baby's skin, we want to assess for a lot of different things, like does the baby have any birthmarks or rashes all over the baby's body? So we're going to look everywhere. Have to undress the baby to do this. And I don't see any on this baby. So I note that. And I'm also looking for lanugo, which is like the fine downy hair. And I'm looking for any vernix, which is like the white, like cheesy substance that some babies have when they are born. And I actually don't see anything on this baby. So I want to note that. I want to check the baby's skin turgor just to make sure that the baby is not dehydrated. I'd also want to check for the presence of jaundice. You'd want to check in 5 places for a baby. You want to check the eyes. You want to check the head, the chest. You want to check the inner thigh. And you want to check like the palms of their hands. Another thing that you want to do, I kind of forgot earlier, but you want to check baby's nose. You want to check to make sure they are breathing adequately out of each side. And so you're going to press one side down and feel in front of the other side to make sure that adequate air is getting passed through. And this baby is fine. So from here on, we're going to go and assess the baby's abdomen. I'm going to listen to the bowel sounds first and make sure everything is moving appropriately. Okay. And this baby, everything sounded fine. So you just want to note the shape and make sure it's not like overly distended or too sunken in, because that could indicate a problem, or maybe that the baby is either pre or post term. You also want to palpate and just make sure there's no masses or anything like that in this baby. Doesn't seem to have anything wrong with him. I also want to note the umbilical cord when I'm down here, and just note like if there's any drainage or redness, or like what level the umbilical cord is at, whether it already like fell off or anything like that. Next we want to go on and look at the baby's genitals. This baby is a boy, so we want to look for a couple things. We want to make sure that the testes are descended, so you'd feel for that. You want to make sure the baby has, like, note whether the baby has any rugae on the testes, and adequate rugae means the baby is a term baby, and if they have more, they're post-term, and if they don't have much at all, they're like a preterm baby. You want to find the urinary meatus, and in this baby he is uncircumcised, so you would pull back the foreskin gently, just barely, just to be able to locate the urinary meatus. And if this was a female, you would want to check like the location of the labia and like see that the majora would be covering like the minora and the clitoris. And also in females, you want to check to see if they have any discharge, because they could have discharge shortly after birth, and it could be whitish in color. And that's all you have to do for looking at the baby's genitals. So after that, we'll put the diaper back on. And we want to check baby's muscle tone to make sure it's adequate. You do this by recoiling the arm and see if the baby has adequate recoil. You also want to look at like the palms of baby's hand and see how many like palmar creases they have in the soles of baby's feet, and see the creases there. And this baby has multiple creases on all of them, which is a good thing. A single crease, that could indicate a problem. So you always want to check for that. And while I'm checking for this, I also know that baby has 10 fingers and 10 toes, which is normal. You want to make sure that the baby doesn't have an extra digit or anything like that. Just note if the baby does. I also want to check for the Babinski reflex, and I would rub across baby's foot, and baby's toes would curve around my finger as I move across baby's foot, and that's a normal reflex. Now that we're done with that, I want to look at baby's spine, so I'm going to have to move baby over on his back. There, I get his shirt off again. Don't want him to get too cold. And you gently move baby over. And you want to look to make sure that the baby has adequate curvature of the spine. And you want to assess for any dimples like on the lower back or any tufts of hair that might indicate like a sign of spina bifida or anything like that. And this baby doesn't have anything wrong, so that's good. Make sure baby stays warm. You want to swaddle him back up, redress him. And another thing I want to assess for is the Moro reflex. And this is when I make a clapping motion beside the baby, and the baby will tense up, and he should shape his hands into a C. And so I would just clap, and then the baby would do that with a C, and that's a normal reflex. And after that, I just want to note what baby's behavior was during the whole assessment, and this baby was very cooperative and calm and everything. And after I'm done, I just want to swaddle this baby back up and make sure he is comfortable. And that's it for a baby assessment.